Well, welcome back to Talk of the Town. Our resident veterinarian, Dr. Craig Pryor, is joining us now to answer your questions, and we love it how the phones always light up because people have lots of questions about their pets, don't they?
There's always something going on with the pet, and there's, misinformation and good information, so we want to sort through it all for them all.
All right, well, you've got the good stuff right now, so why don't we go to our first caller. We'll see if we can get you some help, and this is Renee. Hi, Renee. What's your question for Dr. Pryor?
Hi, Dr. Pryor.
G'day.
My question is about fleas. I have a little Yorkie, and I've treated him, but I noticed yesterday the fleas are all in his face and not so much on his body. What do I do about it? Is there anything else I can do? Because the vet said that I couldn't retreat him. He's so small.
What are you using?
What is it, the Advantage?
Okay. There's lots of different flea products out there, and I can speak for hours about this topic, but a lot of the topicals are older molecules now. They're getting stressed. They're not working as well as they do. I don't see Advantage last as long as they say it does, and that's just something that we're seeing over because it's been out there for so long. What I recommend, what my pets are on they're on Sentinel once a month, and what Sentinel does, it doesn't do anything for your adult fleas. What it does is it sterilizes the flea, so it breaks the flea life cycle. What you're doing with Advantage is trying to kill that 5% of adults that get on your pet. I'm dealing with the 85% that's in the environment. I then add to that a drug called Comfortus. It's a pill that's a once a month as well, and it does the adults for me. So I have total flea control in my house. Ask your veterinarian for Sentinel and Comfortus, and that'll take care of your problem.
All right, Renee, thanks so much for calling. Our next caller is Mary Jane. What's your question?
I have a Jack Russell, and her skin stays pink most of the time, and she scratches constantly.
Sounds like your puppy has a problem called allergic dermatitis. That's where they have allergies. Now, when we have allergies, we get runny eyes and sneezing. They primarily present their allergies through their skin. They can be allergic to just as many things as we can be, and it could be one thing or 20 different things setting them off. So I would have your Jack Russell looked at by your regular veterinarian, and they will actually examine the skin to make sure there's no mites in there or infections or whatever. If it does look like it's allergic dermatitis, then they'll be able to help you out with the treatment of that. But it is an ongoing, and it's just like us. Once you've got allergies, you'll be dealing with them probably lifelong, so just be aware of that.
All right,
so,
Mary Jane,
good luck.
Thank you very much, and I hope that helps you out. All right, we've got George up next. What's your question for Dr. Pryor? Turn down your TV, okay? George, are you with us?
Nope.
No? George? Okay, sorry, we missed you on that one. Hi there, is this Tony? Tony, are you there?
Oh, hello?
Hi, yeah, go ahead, you're on the air.
Oh, yes. Am I on the air right now?
Yes, you are right now.
Oh, this is Terry, not Tony.
Oh, okay, well, good. Sorry we got your name wrong, but Terry, what's your question for Dr. Pryor?
I have two older dogs. They're both about 13 years old and starting to have difficulties getting around. And I had heard that I could give them the glucosamine and chondroitin.
Yes, you can, and they're nutraceuticals. Unfortunately, we don't know how well they work in dogs. We do know that there is a food out called JD. It's a prescription diet. It's developed specifically for arthritis, and it does work. It has the chondroitin and glycosamine in it, but more importantly, it's got the omega-3 fatty acid in it, EPA, and that's what actually turns off the gene that causes cartilage erosion in arthritis. So talk to your veterinarian about which of the Hill's prescription diets is most appropriate for your pet. In this case, JD, it'll work within about 20 to 30 days.
All right, Terry, thanks very much for that call. And let's see, up next we got Tammy. Hi, Tammy, what's your question?
I have a sister, and her skin gets really irritated. She's got a spot on her back that is, she licks it until it bleeds. What can I do for it?
I would take it to your veterinarian because it sounds like it needs to be treated. Again, it could be some type of allergic condition or skin infection, and it probably should be looked at to determine the best way to deal with it, because it sounds like it's ongoing and it's going to be pretty uncomfortable for your pet.
Okay. Anything else we need to know before we go?
Well, just, ask your veterinarian. There's a food recall now on the pedigree foods because of salmonellosis. So ask your veterinarian. I prefer the Hills diets, the prescription and science diets. So ask your veterinarian which are the most appropriate diets, and find out whether your food's in the recall or not. And just deal with that.
It's important information.
Talk to your regular veterinarian.
All right. Thanks so much for being with us, as always.
My pleasure.
We appreciate it. All right. If you'd like to get in touch with Dr. Pryor, you'll find information for how you can reach him on our Talk of the Town hotline. We're back.